friends, today we at MedMiracle will tell you how to prepare for anatomy as a subject, both its theoretical and image-based aspects. We will discuss with you the topics that are important for each and every competition exam that you will face, as well as we will try to tell you that how and where to read them from. Coming to the theoretical aspect of preparation, in anatomy, some of the topics that are most important have been listed here. First comes the arterial supply of various regions. The arterial supply of all the regions is very important, but the major vessels are the top priorities. The major vessels, these include the aorta, the subclavian, the carotids. These and their further branches, the initial branches of all the major vessels, constitute an utmost important part of anatomy and the questions that are asked. Second comes the cranial nerves and their nuclei. This topic is very important from each and every competitive examination point of view. It includes the pathways of all the cranial nerves, the important supply, that is which muscles they supply, which kind of fibers they carry, and at what location in the brain are their nuclei located. The third in this category are the brachial plexus palsies. These should always be read in conjunction with orthopedics. So it will help giving you a strong hold on anatomy, as well as the most important asked pathologies like the damage to various nerves in different orthopedic conditions like fractures, entrapment syndromes, etc. Then we come to the dermatomes of the upper and lower limb. There has been controversy regarding these topics, always specifically in the hand, where there is controversy regarding the dermatomes of the index finger and the ring finger. People are very confused whether it is C6, C7, C8. So take a standard textbook, I'll say Grace, and stick to your answer, because whatever answer you may think is correct in a specific book, you never know where the examiner has formed these questions. So always stick to one standard book, and I think at MBBS level, Grace can classify as the Bible of anatomy. Then we go to the nerve supply of perineum, gluteal region, ear and eye. I don't know why, but specifically love ear in AIIMS. Maybe the ENT department or the professor for anatomy who's involved with the structures involved with eye, ear, nose, throat. Somehow he's specifically making the questions. So the nerve supply of perineum, gluteal region, ear and eye, these are again very important and you should remember them. In general, the arterial supply and nervous supply of all the structures is very important, but I think when you come down to competition exams, these are the most important. Another very important topic for all competitive exams is embryology. First of all, always make a list of structures that are derived from the various germ layers. And the fourth one, which is very important for, I think maybe combined importance of all these three, is the derivatives of the neural crest. So derivatives of ectoderm, mesoderm, endoderm and the neural crest have to be listed according to priority. And also you should have a list which you should revise whenever you get chance to. Then we have the brachial arch derivatives, which is very important. It will come in the form of figure, it will come in the form of a theoretical question, and the spermatogenesis and oogenesis procedure, the whole pathway of spermatogenesis and oogenesis is very important. You should know at what level and at what structure, how many chromosomes are there, how much time it takes, when that kind of division occurs. Is it before the birth, after the birth, that stage occurs. So these questions are very commonly asked and are very important. For embryology, I think at your level, Langman embryology is more than sufficient. We can stick to the answers given here, and I think most of the questions that are made from this book. Then coming to osteology, again the types of joints, whether it's synovial joint, and within synovial joint further types of joints along with examples should be well understood and remembered, because this is a very simple question and will give you a complete mark if you remember the types of joints. In the upper limb, the shoulder joint is very important, as are the structures which are known as the rotator cuff. In the competition exams, sometime or the other, you will definitely have a question on the rotator cuff. Also, questions on dislocation of the shoulder joint are very common. Dislocation is more common, which is the most weakest point of the capsule. These things you should know. Also, the muscles of the upper limb and their actions have sometimes been asked. Second most important joint is the knee joint, and the locking and unlocking phenomena of knee joint has to be known, and the various important ligaments like ACL, PCL specifically. These two should be known, and their insertions and origins should be known, and if there is a deficiency of any of these ligaments, what is the kind of defect that the patient will feel. Also, another important question which may be an overlap with orthopedics is what kind of injury leads to damage to these ligaments. Then we come to an important part of skull anatomy, which is the bones. The important thing here is that these bones are difficult to remember, as the orientation of most students is not there for these bones, especially ethmoid, sphenoid, orbital bones. All these different processes of these bones combined together, and they are very overlapping and very confusing. So always look at images to make your understanding very clear, and it should be pictorial. You should remember in an image based form that yes, this is the ethmoid bone, this is how it looks, how it forms with the sphenoid bone, where are the fissures, and where the superior orbital fissure, inferior orbital fissure, what is coming out from which fissure. So these things you should know well. Also, we should know the difference in various vertebral levels, like how is the cervical, thoracic and lumbar vertebrae different from each other. Coming on to one of the most important topics in anatomy is neuroanatomy. First, the arterial supply in the neural structures is also very important, and one of the most important favorite questions of the examiner is regarding the cavernous sinus. They can ask you anything: the pathology, the boundaries, what are the vessels going through it, what are the nerves going through it. Any structure that is near the cavernous sinus becomes equally important, because they can ask you all kinds of questions with regard to cavernous sinus. You should always be very thorough. Be very, very thorough with cavernous sinus. Second, in blood supply, you should know which part of the brain is supplied by which vessel. So it becomes important in case of stroke. If say a particular region is mentioned, they can ask you the supply, which vessel might be affected, or if a vessel is affected, they can ask you which part of the brain would be affected because of an embolic phenomena in a specific vessel. Also, again, the cranial nerves are important, but in this case, another thing mentioned here are the sections. Sectional anatomy is very important. At the level of midbrain, maybe superior and inferior two sections, pons and medulla. These brainstem sections should be well known, and also the various syndromes that occur due to defect in any of these parts. They will show you that maybe lateral medullary syndrome, Pontine syndrome. You should know what structure is passing through at which level and will be affected in different syndromes. So this is a very favorite question in all competition exams. Also, the boundaries of the different ventricles, specifically the fourth ventricle, is very important. But also know the various foramens that they connect the different ventricles. Then we go to another topic which you will realize suddenly from neuroanatomy. We'll go to the perineum, again favorite of most examiners. Urethra, in here it is mainly the male urethra. All different parts of the male urethra you should know, and you should know which are the commonest locations of strictures or different urethral pathologies. Prostatic urethra for the aspect of BPH, membranous bulbous junction for the aspect of traumatic strictures. Rectum and anal canal, again a very favorite question. Different pathologies arising, the anatomy of the rectum and anal canal, the various folds, and what is the length of the anal canal, because these are very important from surgical point of view as well. So you should know till what level we can do a different kind of surgical resection in maybe cancers of rectum and canal. So from that point of view, this is very important. Also, they will always ask you about the anorectal malformation. So those should also be, AIIMS is also important. The somatic cord and its components is a very important question. So you should know all the components of the spermatic cord. There are few important ones and they should be remembered: the nerves, vessels, and we should also know which nerve is inside and which might be traveling alongside the somatic cord. Then you come to the reproductive system. This is particularly more important in females, whereas the uterus, the supporting ligaments, and how it is connected to the ovaries, broad ligament. These are questions that are very frequently asked, and so the reproductive system anatomy, specifically in females, is very important. In males, is usually the descent of the testes, from what is the path of descent, where there could be a hernia could be present, undescended testes could be present. All these things should be known. Also, the perineal diaphragm is a very important and favorite question. All the components, the perineal diaphragm. Then we come to the next aspect of anatomy, it is the histology. In histology, make a list of all the epithelial linings of the regions you think are important. Say maybe systemically you can go like GI, various structures and their epithelium present there, then respiratory. So this way you can make a list of each structure, say stomach, what are the linings. Then, so if you have a list like this, you have to revise it. Try to make a correlation between the structure and the purpose it is solving, and that will help you in trying to correlate the kind of epithelium that is present. So this is very important. Epithelium, people feel that it is just a topic that they have to mug up, cram, there is no particular concept behind it, but 9 out of 10 times you will be able to realize that the kind of epithelium that was present there was the only epithelium that would have survived in that region. Coming to thorax, you need to know the arrangement of the neurovascular bundle within the thorax, along the ribs, the intercostal muscles. Both in heart you need to know what are the arterial supply to the heart and also the venous drainage. The coronary vessels, very important, have to be known. Some or the other competition exam definitely have a question. Also, you have to know which the concept of dominant vest artery and which arteries are more affected in case of MI, and which artery affected will lead to what kind of MI. Also, a diaphragm. The diaphragm is a very important question in competition exams, may it be its embryology, structures passing through it, the nervous supply. So these are the questions which are pinpoint, and any competition exam will find within the last 4 years the question on diaphragm has always come. Bronchovascular segments, another important concept, because nowadays most of the procedures and most of the divisions of disease are based on these bronchovascular segments. You need to know which bronchovascular segment is associated with which pathology, which is most common where, on what basis bronchovascular segments have been defined. So all this has to be. We will come to the few miscellaneous topics that are very frequently asked in competition exams, like the fascias of neck, the different layers of cervical fascia, and the different structures present in various compartments formed by these cervical fascia are very important for all competition exams. The route of mesentery, reading what are the structures that are going through it, what is the arrangement of the various vessels in the route of mesentery, from where to where it travels, what happens to it in case of mal-rotation, volvulus, all these things regarding the route of mesentery should be known. What is present in the mesenteric border, anti-mesenteric border should also be known. Sphincter of Oddi is again controversial question, and includes questions like what all drains here. It is a constituent of how many sphincters. So how many and what all drains. Now we'll come to the image based aspect of anatomy. Again, there is not going to be much of a change, because both the theoretical and image based topics of anatomy are very similar, as most of the questions nowadays, especially in AIIMS as well as in NEET, are coming image based. So whatever was asked theoretically earlier is now being asked in form of some or the other kind of image. Again, the branches of aorta, the main branches of the subclavian, the main branches of axillary arteries, all these should be known. The arrangement of vessels in the femoral canal, the various portovenous anastomosis, especially the esophageal varices, can be easily asked in an image. It could be an endoscopic image, it could be anything. Also, the circle of Willis, the blood supply of the brainstem, are important images that can come in anatomy. It can also ask you whether the segment of which, because most of the intracranial vessels are divided into further segments like M1, M2, segment of middle cerebral arteries, the multiple segments of the vertebral artery. So you should know which segment is located where. So a simple question can come that this segment of the artery is in respect with which structure of the brain, which brain structure that can occur, and what arterial infarct can cause infarction in which part of the brain. Again, dural venous sinuses, cavernous sinus can easily come as a question. The arrangement of nerves along the cavernous sinus should also be well understood in image form as well. This is an example of image where third part of the vertebral artery relation with the C1 vertebra is being shown. It was a question recently asked in an AIIMS exam. and so it's very important that this is the V3 segment and not the V2 or the V4 segment. V4 is the intracranial segment and V2 segment is the segment present beneath along the various transverse foramina. Also, this is an important image. You can see here that this is showing the anatomy of the perianal fossa. So ischianal fossa, perianal fossa, where abscess, the anatomy is very important. The pelvic diaphragm, the constituents of pelvic diaphragm are frequently asked in most. Again, an image of the pelvic diaphragm seen from above, below, and we can see the various components of pelvic diaphragm, the levator ani muscle, the coccygeus muscle, the main two components. The levator ani can further be divided into iliococcygeus, pubococcygeus. You should know the anatomy of the pelvic diaphragm. Nervous system again. Cranial nerves, now most commonly having asked in form of images. The various parts, the genus, the ganglions which are associated with each of them, from where they arise, where the nuclei are located. So one of the most important nerves according to me in cranial nerve is the facial nerve. It has a lot of inherent questions associated with it in form of the various things that I've talked before, the nuclei, the cores. Something or the other about the facial nerve is very peculiar and should be known. Brachial plexus, injuries, what part of brachial plexus gives rise to which nerve, what injury can cause what kind of deficit, it can all be shown in pictorial form as well. The dermatomes of upper limb, lower limb, which we earlier talked about, was being asked, now can be shown, and they can be seen at which part or what dermatome supplies this part of the hand. Nervous supply of ear, so will show the posterior part of the ear or the lobule, and they'll ask you what are the supply, and the anatomy of the internal acoustic meatus can also be asked. The petrous apex, location of various pathologies there. So these things can be asked in form of images as well. This is an image, beautiful image, mainly taken from Netter's Atlas, and this is just to show that how beautifully they depict most of the cranial vessel, cranial nerve nuclei, and the orientation which we try to keep mugging up. This is ventral, this is dorsal, supplying this, coming out from this. We don't have to mug that up. We can just have a look at it multiple times, and then you'll get a visual impression in your mind that you'll never forget. So always keep such images in front of you when you're reading anatomy. Pick out your images and keep them with you. Again, this is another different position, different view by which they have shown these nerve nuclei and from where the nerves are rising. You will not have to remember that which is coming from the pons, which is coming from the medulla, which is from the ventral side, which is from the dorsal side. All of this will become ingrained in your mind with such images. This again is another type of question that can come from the cranial nerve nuclei. Here the various lesions in the optic tract, the pathway of the optic tract or the optic nerve have been shown, and what kind of field defect will they cause. So this is again a very important question that can also be classified under cranial nerves. So sensory cranial nerve. In the neuroanatomy again, this is a question that have been previously asked, where different kind of projectional fibers have been marked and different important structures of the gray matter, including the basal ganglia, which I consider is one of the most important topics in brain, have also been shown, and they can be easily marked, and you can be asked what are the structure that is being shown here. This here is another diagrammatic description of the various structures of the basal ganglia, and they should always be correlated with the real anatomic specimen, because mostly in the exam it is the real anatomical specimen that come, but diagrammatic representations help you to understand which part is placed where, and then you can correlate with the real anatomic sections. The muscles, the most common and most important question that is asked is the muscles of mastication, and in this there's two things that you must remember, that the one muscle which depresses the mandible is the lateral pterygoid, and the one muscle which retracts the mandible is the temporalis. So in this way, if you remember the one muscle that causes this action, the other three you will be able to remember which cause the opposite action. So the depressor is the lateral pterygoid and the retractor is the temporalis. Also, The common extensor and common flexor regions, which are the muscles that are arising from them, should also be known. The extraocular muscles of the eye is another important topic which is commonly asked. The supply of each of the extraocular muscle, whether it is from the same side, opposite side, these things should be known. Another very important topic, which I should call competitive exam topic. This is a competition exam topic. Very important. All the foramens, all the canals that you can find, they have a particular arrangement or a particular set of structures that are passing through it, should be remembered very well, especially if they have any clinical significance. Then these canals and these foramens are a definite competition exam question. The ones that I have invented, it could be present in anywhere in the body. If we start from the cranium structure, the skull, we can see the various foramen in the base of skull, like the foramen ovale, rotundum, spinosum, jugular foramen. All the structures that are passing through these foramens should be known. The location in an image should also be known, because they can just likely mark and not tell you which foramen. But if this foramen is marked, what are the structures that are going to pass through it? The opening of various meatrices of the paranasal sinuses are important. The fissures of the superior and inferior orbital fissures, various structures passing through the diaphragm, the thoracic inlet, again the anatomy of the inguinal canal, the femoral canal. All these things are very important and can be easily asked in the form of images. So foramen and canals are a very important competition examples. This here is a beautiful image showing the various foramen in the base of skull and the various structures passing through it. It is a very nice way of remembering these things, because these are very easily confused. In the exam, always be a confusion between two structures, two options, and at that time your pictorial memory, image based memory will come to your rescue. Again, this is here the anatomy of the inguinal canal, how the borders of the Hasselbeck triangle, the inferior epigastric artery vein, orientation of all these, the femoral canal, the femoral artery veins is very important. And once you are oriented with these, you don't have to mug up a particular question that was once asked. Any variation of that kind of question you will be able to solve if you have the basic anatomy fixed in your mind and you've understood it well and not just mugged it. This was a question that was once asked in a competition exam, with which of these nerves is affected when taper for the mesh is placed too laterally. If you would have an image based memory or you have pictorial memory, this would not have been a very difficult question for you, but at that time very few people were able to get it correct. That is what is the importance of having anatomy in your mind in the form of figures and images and not just text. Another foramen, that is a different kind of foramen. This is the epiploic foramen, bounded by the free edge of the lesser omentum, because part of duodenum, the liver. So this is going to and giving entry to the lesser sac. So epiploic foramen has also been commonly asked and is a favorite among more examiners. Coming to embryology, again the aortic arch derivatives, which are initially or previously important, historically important for text or theory based questions, are again have become important in the image based world as well. So aortic arch derivatives, pharyngeal arch derivatives, branchial arch derivatives, whatever and whichever arch derivative you can find, you have to know the images for each of them as well, because now they will not give you the numbers or the structure and they'll just mark it for you, and they'll ask what structure arises from this pouch or what structure arises from this arch. So that is very important now. Also, the types of tracheoaxial fistula can be easily asked in the form of images. The development of diaphragm from the four structures, which is derived from where, what part of diaphragm is formed by which structure, can be easily asked in the form of images. The development of kidney, again, which part of urinary system is formed from which nephros, mesonephros, metanephros, all these things can be asked by marking it in an image. Meckel's diverticulum, sacropexular teratomas, urachal cysts, sinus fistulas, maybe in form of anatomical images, maybe in form of radiological images, dye studies can come as images. The external genitalia derivatives again can be easily asked in the image form Also, the process of spermatogenesis and oogenesis, instead of asking directly in text form, they can show you that what is the stage, what are the number of chromosomes in this stage of spermatogenesis. An example of image that can come for embryology, this is the development of the heart septum, a very important concept, has been going on and being asked in every competitive exam. So they can show you which is septum primum, which is septum secundum, ostium primum, fossa ovalis. So these are structures easily marked for you and you just have to recognize. So it is not a very difficult question if you once seen the image yourself before. It will be a very straightforward question for somebody who understands, but very difficult for somebody who has just read the text and come. Again here, this is the way they can mark various pouches and ask you various clefts, what are the structures they will give rise to. So now only remembering these structures in form of tables is not important. Get away with something like this, phalangeal pouch 1, this is the derivatives, second derivatives are these. But now you cannot get away with just remembering this in the form of theoretical knowledge. This again is a image that helps us to remember that the nucleus pulposus is a derivative of notochord. May not be necessary always, but sometimes when you think that you're going to get confused, what are the structures that are going to be from the notochord or something that is being continuously asked and you're not able to find a way to remember it, try to find an image that will help you keep it in your memory for a longer time. Retaining what have you read is even more important than reading a lot more. Finally, coming to histology itself, I think it should never have been asked in the form of theoretical questions. Now that the images are coming, I think histology is very important, may it be pathology, in microbiology, or in form of anatomy itself. In anatomy, there are fewer questions because they don't really ask the normal things in histology. But even then, some of the important normal epitheliums, cartilagic appearances have been mentioned here that I think we should know, especially like something like the transitional epithelium. How does the cardiac muscle look like? How does the hyaline cartilage look like? These differences in different type of cartilages, how are the structures arranged in the spleen, the white pulp, the red pulp, these are important. Also some of the cells like plasma cells, eosinophils, which are characteristic, they may be asked in anatomy. This could be an overlap with pathology where a medical scenario is also given, maybe it's like something like a round cell tumor or multiple myeloma, and then a particular cell may be asked, shown in histopathological slide. Okay, the glands, different type of glands, merocrine, apocrine, holocrine gland, they can show you cells and tell you that if this whole cell is broken down in time of secretion, they can ask what kind of gland is this. So anything can be asked from histology when you come to the foray of image-based questions. So this is a mind overview for everyone who is struggling in their preparation for anatomy and how to streamline it, especially when you have a very limited amount of time available for you. Go for the high yield questions. Do not try to mug up everything. Do not take up big books and try to remember text. Try to remember everything in the form of images. Read books like Netter's. Sometimes people ask me, how do you read Netter's? You just have to read it or look at the image again and again. Whenever you go back to doing your MCQs, you'll realize that this I saw in that book, or something you'll realize that I don't understand it. Then you go back to your images, you'll be able to see, yes, this was something I missed, this concept I missed at that time. I saw this image but I didn't realize what was the importance. So in that way you'll correlate and finally that will get ingrained in your mind. So anatomy is a slow process, it will come to you. So try to be smart about it. Do not worry if you were not able to retain everything in the first go. Thank you.